Hello and welcome to my channel. Today's lecture will continue our talk about the anatomy of the tooth, so let's begin. We studied the structure and the function of the teeth and the numbering system used to number the teeth. Now we're going to talk about their development. You know, as we studied before, there are primary teeth and permanent teeth. The primary teeth start to form in the embryo between the ages of 6 and 8 weeks, and the permanent teeth begin to form in the 20th week. If they do not develop, they will not develop at all, and there will be a case of hypodontia. In the pharyngeal arch, where the tooth develop, there is a growth factor that stimulates the development process, and the development of the tooth is divided into stages. As you can see here, starts with a collection of embryonic cells called the placote stage, then passing through the bud stage, the cap stage, the bell stage, and the full maturation stage, as you can see it here, this process of development. The tooth bud, sometimes called the tooth germ, it's an aggregation of cells, and it's organized in 3 parts. The animal organ, as you can see here, the dental pulp or the dental papilla, and the dental follicle. The animal organ, which is the one you see here, is formed of multiple layers: outer animal epithelium, inner animal epithelium, a layer called stellate reticulum, and a layer called stratum intermedium that form the composition of the animal. These cells give rise to ameloblasts responsible for the formation of the animal. Now, the dental papilla contains cells that develop into odontoblasts, and as we studied before, the odontoblasts are responsible for dentin formation. The dental follicle comprise many cells like cementoblasts to form cementum, osteoblasts, and fibroblasts. The cementoblasts form cementum, the osteoblasts form the socket, alveolar socket around the tooth, and the fibroblasts responsible for formation of the periodontal ligament that will fix the tooth in place. Then eruption starts. Eruption where the tooth enters the mouth cavity and becomes visible. The periodontal ligament is an important factor in the tooth eruption. It starts around the 6 months until 2 years of age, and you know, the milk teeth, all of them erupt. Then some of them start to be replaced by permanent teeth. This stage, in which there is a mix of permanent teeth and milk teeth, this is called the mixed stage. The mixed stage lasts until the last primary tooth is lost and the remaining permanent teeth erupt into the mouth. And there are theories about that eruption. It was thought before that simple pushing mechanism of a tooth that pushes it into the mouth. Currently, studies showed that the periodontal ligaments are the responsible factor for eruption. It was also correlated, the primary tooth loss was correlated to strongly to somatic and psychological criteria of school readiness. So it's a sign, i.e. it's a sign for school readiness. Supporting structure of the tooth is called the periodontum, It helps to attach the tooth to the surrounding tissues and allows sensations of touch and pressure. It consists of the cementum, here, the periodontal ligaments, this pinkish layer, the alveolar bone, this is the alveolar bone, and the gingiva. The cementum is the only one that is part of the tooth. The rest are the external tissues. The alveolar bone surrounds the roots of the teeth and provides support and creates what's so called as the socket of the tooth. And covering the bone is the gingiva or the gum. The periodontal ligaments, the ones you see here, is a specialized connective tissue that attaches the cementum, this yellow layer, to the alveolus or to the bones of the alveolar socket. Each ligament has a width of 0.15 to 0.38 millimeters, and the size decreases over age. The functions of the periodontal ligaments include attachment of the tooth, support for the tooth, formation and resorption of bone because it reacts to pressures applied, the periodontal ligament capable of sensation, and of course is the one responsible for eruption. These are the functions of the periodontal ligaments. The cells of the periodontal ligaments include the osteoblasts, osteoclasts, fibroblasts, macrophages, cementoblasts, and a bunch of epithelial cells called the rests of molasses. The fibers, collagen fibers there are of type 1 and 3, and they are given names according to their location. The nerve supply generally enters from the bone apex to the tooth and forms a network around the tooth. And during chewing and biting, when there are pressures exerted on the tooth moves slightly in the socket and puts tension on the periodontal ligaments. By this way, the nerve fibers can then send the information to the central nervous system about the condition of food that being chewed. Regarding is it solid, is it soft food, and etc. The alveolar bone is the bone of the jaw, which forms the socket, and osteoblasts create the bone. Osteoclast shapes it or destroys it. All of you know the fixtures applied to the tooth to correct their position. This is part of orthodontics. It depends on when you apply compressive force from a tooth moving toward it, this area will have a high osteoclast level. So the bone resorption will begin in this area. While on the contrary, on the other area, on the other side, an area of bone receiving tension from the periodontal ligaments, not compression, this will result in the increased activity of the osteoblasts, so increase in bone creation on the other side, and this results in changing the direction of the tooth over time when applying such orthodontics. All this to explain the role of the periodontal ligament in fixation of the tooth. Now the gingiva or the gums, it's visible inside the mouth. There are three different types of epithelium associated with the gingiva: the gingival epithelium, the sulcular epithelium on the top, and the junctional epithelium here. Now, the gingival epithelium is associated with tooth attachment and is visible inside the mouth. It's covered by a layer of sulcular epithelium, which is non-keratinized stratified squamous epithelium. At the top is the one you see here, and the junctional epithelium is an area of basal lamina and hemidesmosomes. These are kinds of connection between the cells, form of contact between the cells to fix the cells, to fix the tooth in place. Okay, this is the function of the junctional epithelium of the gingiva. The tooth decay, the plaque that forms, forms over time, it's a biofilm mostly consisting of bacteria. If it's not removed regularly, it will lead to gingivitis, and given time, plaque can mineralize along the gingiva and forms what's so-called the tartar. The microorganisms that form the biofilm are almost entirely bacteria, as mentioned, of the Streptococcus strain and anaerobes, and one strain responsible for decay is the Streptococcus mutans. It's the most bacterium associated with dental caries. The bacteria live off the remains of foods, especially sugars and starch, the result of digestion of carbohydrates in the mouth. And in the absence of oxygen, they produce lactic acids, which reduces the pH in the mouth and results in losing the calcium and phosphorus from the animal over time. This process is called demineralization, and it leads to tooth destruction, of course. Now, what compensates for this? The saliva. The saliva returns the pH of the oral cavity to around 5.5, so it's somewhat alkaline to neutralize the action, and remineralization begins in the tooth. I mean, they retain their calcium and phosphorus. Saliva, of course, is unable to penetrate through plaque, but it's able to neutralize the acid produced by the bacteria. The caries or dental cavities, sometimes called tooth decay, is an infectious disease which damages the structures of the teeth. It leads to pain and, of course, tooth loss and infection. Tooth decay etiology, it's caused by certain types of acid-producing bacteria, as we mentioned before, that survive off the starch and sugars in the mouth, and in the presence of fermentable carbohydrates like sucrose and fructose and glucose, these cells thrive on it, and this will result in acidic levels in the mouth that affect the teeth, because the tooth's special mineral content causes it to be sensitive to low pH, as mentioned before, which is neutralized by the saliva. Now, the Dental Health Organization stated some preventive and prophylactic measures, such as regular oral hygiene, dietary modifications to avoid dental caries. I hope you got the maximum benefit from this lecture, and thank you very much for watching.